Why travel medical bills reach $100,000? What tourists are never told before you travel. There is one truth you must understand. Medical emergencies do not care that you are on vacation. They do not care about your budget, your plans, or your return ticket. And when they happen abroad, the cost can be so high that it changes your life permanently. This is why so many tourists come home not with memories, but with medical bills reaching $50,000, $70,000, or even $100,000. Most people believe this kind of bill only happens in rare or extreme cases. They think it is exaggerated, used only to scare people. But the reality is very different. These bills happen every day. They happen to normal travelers, families, students, and business tourists who never imagined something would go wrong. Travel feels safe until the moment it isn't. You plan flights, hotels, meals, and activities. Everything seems under control. You feel healthy. You feel confident. And then suddenly, one unexpected moment changes everything. A fall. A sudden illness. An accident. Within hours, your trip turns into a financial nightmare that follows you long after you return home. One of the biggest mistakes travelers make is assuming hospitals abroad will treat them fairly. People believe prices will be reasonable, or that insurance will automatically cover everything. That belief is the reason tourists are shocked when they see the bill. Medical systems around the world do not work the way most people imagine, especially for visitors. Let's start with the United States, because this is where medical costs rise. The U.S. healthcare system is the most expensive in the world. Hospitals are not public services. They are businesses. Prices are not fixed. Every service is charged separately. When you enter a hospital as a tourist, you are billed at full international rates with no protection. A simple emergency room visit in the U.S. can cost anywhere from $3,000 to $10,000, even if no serious treatment is required. That cost includes being seen by a doctor, basic tests, and observation. Add blood work, x-rays, or scans, and the bill grows immediately. One night in a U.S. hospital can cost more than an entire vacation. If the situation becomes serious, the numbers increase dramatically. A broken bony internal injury or severe infection often requires surgery. Surgery alone can cost $20,000 to $50,000. If intensive care is involved, costs can exceed $10,000 per day. Just a few days is enough to push the bill beyond $100,000. Tourists are especially vulnerable in these situations. Hospitals assume tourists may leave the country without paying. Because of this, hospitals often demand deposits, advance payments, or immediate proof of strong insurance. If you cannot provide it, treatment still happens, but billing becomes aggressive. Credit cards, loans, and long-term debt become the only options. Europe is often misunderstood. Many travelers believe healthcare in Europe is free everywhere. That is only true for residents who pay taxes into the system. Tourists are treated differently. In countries like Germany, France, Italy, and Spain, tourists are often directed to private hospitals or charged international rates, even in public hospitals. A hospital visit in Europe may be cheaper than in the US, but it is not cheap. Emergency treatment, surgery, or specialist care can still cost thousands. A few days in a hospital can destroy savings. Without proper coverage, tourists are billed directly, with no protection. Now let's talk about the cost most travelers never expect. Medical evacuation, if doctors decide you need to be transported back to your home country for treatment. This is not a normal flight. Medical evacuation requires specialized aircraft, trained medical staff, equipment, and coordination across borders. The cost of medical evacuation can range from $50,000 to $100,000, sometimes more. This single event has financially destroyed families, and most domestic health insurance plans do not cover evacuation from abroad. Many cheap travel insurance policies do not cover it either. Another major misunderstanding is health insurance. Many people assume their health insurance at home will protect them internationally. In reality, most domestic health insurance plans are designed only for care within your country. Some may offer limited reimbursement, but that usually means you pay everything up front and fight paperwork for months. During a medical emergency, hospitals do not wait for reimbursement discussions. They treat you, then they bill you. If insurance refuses or delays payment, the responsibility is yours. This is why relying on domestic health insurance abroad is extremely risky. Credit card travel benefits create another false sense of security. Credit cards often advertise travel protection, but medical coverage is usually minimal or non-existent. At best, they cover trip delays or baggage issues. Relying on a credit card for medical emergencies is one of the most dangerous assumptions travelers make. So why do medical bills grow so fast? Because hospitals charge for everything. Doctors, nurses, equipment, tests, medication, beds, oxygen, administration, and emergency services are all billed separately. Each item adds cost. Tourists receive no negotiated rates, no discounts, and no protection. Follow-up care adds even more costs. Medical emergencies rarely end in one visit. You may need follow-up tests, medications, or specialist appointments. A $10,000 emergency can quickly turn into $25,000 or more within days. Medication costs alone can shock travelers. In the U.S., prescription drugs without insurance can cost hundreds or thousands of dollars. Pain medication, injections, and specialized treatments all add to the bill rapidly. Another dangerous mistake tourists make is delaying treatment. Many people avoid hospitals because they fear the cost. This often makes the condition worse. A small issue becomes a serious emergency, increasing both health risk and financial damage. So how do smart travelers avoid this nightmare? The first step is understanding reality. Medical emergencies abroad are not rare, and they're not affordable. Planning for worst-case scenarios is not fear. It is intelligence. The second step is choosing real travel insurance, not cheap insurance. A policy that costs very little but offers low coverage is not protection. For international travel, medical coverage should be at least $100,000. Medical evacuation coverage should be at least $250,000. The third step is reading exclusions carefully. Many policies exclude pre-existing conditions, adventure activities, or specific treatments. If you plan to hike, ski, scuba dive, or rent bikes, make sure your policy covers accidents related to those activities. The fourth step is understanding how claims work. Good travel insurance companies coordinate directly with hospitals. Weak ones make you pay first and argue later. In emergencies, coordination matters more than promises. The fifth step is keeping documents accessible. Save your policy details, emergency numbers, and coverage information on your phone. In a crisis, you don't have time to search emails. Families and older travelers need to be especially careful. Medical emergencies are more likely with children and elderly travelers. Insurance becomes non-negotiable. Business travelers also underestimate risk. Short trips feel safe, but emergencies do not care about trip length. There is also a psychological side to this problem. Stress makes emergencies worse. Panic leads to bad decisions. Knowing you are covered allows doctors to act quickly and correctly. Protection is not just financial. It is mental. Now, let's be honest. Nobody enjoys buying insurance. Nobody likes reading policy documents. But ignoring reality does not make risk disappear. Spending an extra $50 or $100 before travel can save tens of thousands later. Travel insurance is not an expense. It is a financial shield. It protects your savings, your future, and your peace of mind. One decision before your flight determines everything. A vacation should give you memories, stories, and experiences. It should never give you debt, lawsuits, or years of financial recovery. Medical bills abroad are real. They are massive, and they are unforgiving. If you remember one thing from this video, remember this: preparation is the difference between a bad day and a destroyed future. Understand the system. Plan correctly. Protect yourself. Travel smart, stay prepared, and never underestimate the true costs of medical care abroad.